Welcome to Mind Over Matter, where we feature young Jamaicans who are shooting for the stars. I'm your host, Margaret Boyne. He is a recipient of the 2022 Governor General's Achievement Award for the parish of Westmoreland. He's a past student of Mannings High School. He holds a Bachelor of Medicine, Bachelor of Surgery degree. He's presently a final year student pursuing a master's degree in applied data and science at the University of the West Indies. He will be doing his postdoctoral studies in biomedical informatics at Harvard University later this year. My guest is Dr. Elombe Calvert. Congratulations, Dr. Calvert.
Thank you so much for having me.
And
thank you so much. It's a pleasure being here.
Yes, and it's a pleasure having you too. How do you feel about recently receiving this award? And tell me what does it mean to you?
Well, so I feel very honored to be awarded the Governor General's Achievement Award for Excellence just a month ago. It means a lot to me because the award itself, it recognizes Jamaicans who have been doing a lot of work in their communities and have excelled in academics. And it's also a tribute to the groundwork that we're doing in the community and how that can be used to influence upcoming young persons who are looking onwards and want to do well as well.
You're a medical...
So it really means a lot.
Okay. You're a medical doctor. Why did you want to become a doctor?
Okay, so from as long as I can remember, I've always loved the human body. And from I was in high school, I was just fascinated with the sciences, and that path seemed very natural to me from I was in high school. However, growing up, I really connected with people, and I really wanted to find a career path that allowed me to really help people. And fusing that with my love for the human body and science, I saw medicine as the only career path I wanted to pursue.
Okay, you finished your degree in 2020. Where did you do your internship?
So I finished in 2020, and I chose the University Hospital of the West Indies to complete my internship, and that's in Kingston.
Okay, and of course that was during the pandemic.
Yes, so we're actually the first group of interns to work within the pandemic. It was definitely hard because nothing in training actually prepared us to work within the pandemic. Because the thing is that the patient load and how sick they were, it was really overwhelming. And also the emotional toll it had on just all of us, because you're constantly seeing persons die every day on the ward. So it was a challenge, definitely.
So how did you manage, how did you handle all of that mental stress?
It was hard, but the team at U were really supportive. We help each other, and having that strong support system definitely helped. I tried to cope as best as possible. I wouldn't say that I coped like really, really well, but it was a work in progress. It was a work in progress, day by day, just understanding what's going on, because it was a novel situation. So day by day, week by week, we conquered, and we, got accustomed to the new normal. So it was definitely a challenge, a novel one at that.
So did you lose any family member or any friends during from COVID?
Fortunately, I did not. I did not lose anybody to COVID. I'm really, really, really glad for that.
And if that wasn't enough pressure and stress, you are also doing a master's in applied science at the same time. So that would have been a hefty workload. So how did you manage all of that at the same time?
I don't think I managed, but I definitely tried my best. I tried to be very focused and disciplined. So when I'm off from work, I tried to get a lot of my work done. It was definitely a concerted effort because I have this really supportive group in my court at UE. So if, for example, I was on duty and I missed a class, they would help me catch up, because the things that I was doing, I never did before. There was a lot of emphasis on like programming and a lot of math, things that I didn't do in my previous degree. So it was a steep learning curve, but I had a very, very supportive classmates and also lecturers who actually helped to make the transition and my time during the program a smoother one. But it was still hard. I had to be constantly messaging, like emailing my lecturers saying, you know, I have a duty this day, so can I submit this time, and constantly trying to make a really good schedule in terms of submissions. But they made it a really good transition. So I'm very, very happy for that.
Okay, so when did this interest in computers start?
It started when I started internship, to be honest, because being in the medical field, I was just realizing that we have a lot of issues and challenges and very challenging questions that need answers. And I feel like we collect a lot of data on patients, but it's not properly being utilized so as to answer these very difficult questions. And also the way in which it's being stored here, because a lot of our data is handwritten. So even if we wanted to apply like artificial intelligence analytics to it, it would be a very, very, very hard task. So having experienced all of that, and also a precursor to that coming from medical school, also just seeing how everything is addressed within the healthcare sector here, that kind of fueled my interest and also my desire to enter into the program. And through the program, my mind has been expanded, and I learned about the intersection between medicine and informatics, being biomedical informatics. And that started my interest into looking into these programs, that brought me to Harvard and other schools as well, like NYU, Chicago, University of Pennsylvania, and the Icon School of Medicine at Mount Sinai, but eventually chose Harvard.
Okay. So is technology the future of healthcare? Do you think so?
It is definitely the future of healthcare. But the thing is that we need a lot more persons that are at the intersection, because currently we're divided. You have the computer scientists at one end, and you have the doctors or the persons in the healthcare sector. So nobody currently, or very few amount of persons, are really at the intersection, and so that vision is lacking. But it's definitely the future, because the promise of AI and informatics in terms of delivering precision medicine and personalized diagnosis and treatment to patients, and using that to overall better health care and health delivery services to patients is remarkable. But again, we need the requisite infrastructure in place, and also trained personnel at the intersection, so as to even start having those conversations here in the Caribbean, also in other emerging markets as well.
Okay, so this field is an emerging field that probably more of our doctors can go into as well.
Definitely. So it's an emerging field, but we are probably like 10 years behind the rest of the world. But it's growing every day. It's very dynamic. It's always changing, because the technology and also our computational ability is increasing every day. So it's definitely emerging, definitely changing. And scientists and persons at the intersection are working towards utilizing AI to better healthcare and also medical research. So it's definitely something I would love more computer scientists and also doctors here in Jamaica to actually pursue.
So, Dr. Calvert, give us a little preview of what, how in the future healthcare will look with all this artificial intelligence and, data.
No problem. So imagine you get admitted to the hospital, and based on your prior visits and based on the scans that you've currently done while in hospital, your blood work and all the information that you provide to the doctor, you have like an augmented intelligence that can help the physician to tell you exactly what's happening to you, and based on what's happening to you, what are the best investigations to order and what are the best drugs to treat you with based on your personalized data. So it's not just, okay, we've done a lot of studies on just this general population of persons, but we're using your own data to see what is the best management plan for you. And also what that could also look like, also moving from the management side, but also like patient monitoring. You could probably be in a hospital room and you have sensors that are feeding data into an artificial intelligence system that alerts the nurses and doctors that, okay, this person's blood pressure is dropping, let's come. So that what that does for us is that it eliminates the constant human monitoring of certain things that can be inaccurate and provide like quicker responses to deterioration or any abnormalities that might occur.
So during the COVID pandemic then, would you say that there was a lot of data gathered that would have helped with this kind of informatics?
So definitely, and even with my own experience, because I worked as a COVID intern for 2 months, and I was a senior host officer on COVID for an entire month. And I personally seen patients when they come in, they're really sick, and unfortunately, until they demise. And we, as you alluded to before, we have a lot of data that is currently not usable because, again, I was telling you, there isn't a lot of emphasis on how we store the data because we're not at the point where thinking that this data and analytics can actually help us and guide us in the right direction in terms of diagnosing patients and also choosing the right management plan for them. But having gone through the pandemic as a medical doctor, that has inspired my interest in actually using data from that period so as to develop some type of platform that can aid in the workflow that I just outlined before, from diagnosis to treatment of patients. So so in my final research project here at the University of the West Indies for my master's program, I want to develop a platform that uses radiological imaging and also data collected from patients, whether that be blood work, examination findings, the information that either the relatives give to the doctor or the patient themselves, to develop a system where we use that data to diagnose patients and also to prognosticate them. So we can tell, okay, based on this patient's current condition, they are really sick, they're mild, moderate, so we can stratify where they currently are and predict also what's the likelihood of this patient dying, what is the likelihood of this patient being admitted to the ICU, what is the likelihood of this patient recovering, and through that we can better streamline the very limited resources that we have. So that's currently what I'm working on. But the thing is, that I was saying before, the data that we currently have is very inaccessible at the moment. So I'm actually outsourcing data from China, from the Wuhan area, hospitals are there.
Okay. So you'll be doing your postdoctoral studies at Harvard University,
Yes.
studying biomedical informatics.
Yes.
So tell my viewers what exactly is biomedical informatics for those who probably don't, know.
No problem. So to simply put, biomedical informatics is basically the intersection of medicine and also data science or computer science. So it's basically using biomedical data, whether that be blood work, imaging. It can even become more precise where we're going into like molecular data from patients, genetic data from patients, so as to answer any medical or biomedical question that we have within medicine. What's this diagnosis? What's the best treatment plan for this patient? How can we better optimize this patient's care based on all the data that we have? Mm-hmm. So that's basically what biomedical informatics is in a nutshell at a very, 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 very high level.
Okay.
And the thing about the Harvard program is that it has different tracks. So coming from a purely clinical background, I'm able to choose a more clinical track where I work with a lot more clinical data, so data that would produce within a hospital setting. And there's also a track for more like persons from a basic science background, so persons who have been working with genetic data, proteins, of that type of data. They can also choose that tract based there. They can also choose that tract, or you can do a mixture. So it's all based on what your future plans are and how that will shape your career in the future. So it's a very flexible program for you to acquire the skills that you need to accelerate your career in the future.
But you're from Westmoreland. No, where exactly in Westmoreland are you from?
So I am from Big Bridge, Little London in Westmoreland.
Okay. So
a very, very small community.
Mm-hmm. I've read that you had some setbacks in your teenage years. Can you tell us about that?
Okay, so when I was around the age of 16, my family lost our home to a fire. I'm not sure what actually caused the fire, but our entire home was destroyed. And for probably the following 2 years, we're basically separated, because at the time I was living with my grandmother, and my siblings were, I think, living with my other grandmother in Mandeville, and my parents were living apart. So it did cause a lot of dislocation within that time, and also a bit of financial instability. But over the years, with the support of family and friends, we've been able to rebuild and yeah.
So did it affect you in any way at that time?
It did, but fortunately, it wasn't in a bad way. I've always had a very positive outlook on life, so I didn't allow that incident to, throw me off or act as a negative stimulus. I viewed it as probably a way to start over, and also start to take life a bit more seriously, because I could have lost my life. So from then, I started to capitalize on all the opportunities that were presented to me, and I started to really, I was doing well in school, but I started to do really well after that, because I really used it as a motivation to really do well. And through that, I would say that incident allowed me to better connect with people, because especially persons like patients within the healthcare system, because I can understand what it means to lose something. And a lot of those persons have, exactly, a lot of persons are on the brink of losing their life. So it has made me a lot more empathetic, and I can relate to these subset of persons. And I would say it's definitely that understanding and insight that I've gained definitely swayed me to also become a doctor. because I could empathize with patients a lot better.
You went to Mannings High School.
Went to Mannings.
And you did very well. I mean, you had 14 subjects, CSEC distinctions, and 8 CAPE subjects distinctions.
Yes.
You are the top CSEC Male Student. This is amazing, man.
Yes.
Yes.
I think it's the environment at Mannings. We were never limited. So it's like there's this like unspoken narrative there that you can be whatever you want, you can achieve anything you want. And I had a very, very brilliant group of friends there. So we were just trying to do our best, and at no point we thought that we would have failed or not do well. So it was just a really, really good environment at Mannings. I definitely enjoyed my time there and all my interactions experience there. It was really, really good and inspiring. Something that has served me until now, that you can achieve anything you want through hard work.
Yes. Who were some of the persons who were influential in your life? And this is a chance to hail them up and say thanks, you know?
Oh, okay. Okay, so I think at the very bare minimum, I would really love to thank my parents, my mother, Yuli Gordon, my father, Richard Calvert, and my eldest sibling, Sean. I think they have, throughout the years, shown me a lot of love, compassion. They have believed in everything that I've pursued, and I just really, really want to thank them. In my earlier years, though, in terms of role models, especially at Mannings, I would definitely say Shaquille Dias was a really good role model. He's also a brilliant Jamaican as well. He is going to Johns Hopkins this year to pursue a PhD in biomedical engineering. He's also a doctor. He, I would say, in my earlier years at Mannings, was a really, really good role model. But now, let's keep it at that. Yeah.
What would you say?
But and also my classmates currently in my master's program. Oh. I have to give them a shout out. So Clifton Lee, Winfio, Denise and Dennis, and Simon Lee. They have been really, really, really good friends through this entire period. Over the last 2 years, I couldn't have finished this program successfully without them. I definitely have to give them a big shout out. They've been amazing people.
Okay. What would you say is the most satisfying part of being a doctor?
The most satisfying part of being a doctor is you're in the street, you've forgotten about the patient that you've treated, and they come up to you and say, "Oh, doc, you remember me from like 2 months ago? You treated me really well, and I'm really good now." And to just add a bit of background to that, when I was on COVID, I met this particular patient, and I remember him very vividly right now. He was very, very, very ill. I remember he was crying at one point. He was fearful of his life. And we worked a lot with him, and he made a miraculous turnaround, and he got discharged. And I saw him the other day, and he was doing his job. And it was so amazing to me that he's now integrated back into society, fully functional, not ill. So I think that the gratification that comes from seeing patients recover is, I think, the best part of medicine. That's the best part. It's not the money or the so-called prestige. It's seeing patients get better and seeing them reintegrated back in society as fully functional, healthy beings. I think that's the best, definitely the best part of medicine for me.
But now that you've mentioned that, how do you prepare yourself mentally, though, for cases where, you probably form some kind of bond with a patient who, don't make it, How you deal with that?
I think I do understand. So I think it's accepting that, you can try your best, but at the end, it might not work out. So it's just understanding that that's a possibility, and it can occur within this field, and we see it a lot. So it's just getting accustomed to understanding that that's a possibility, and even if you've formed a really good bond with the person, not to let it affect you a lot. Not saying that you're not sympathetic or empathetic, or you don't feel, but you do understand that that's a possibility and it can happen. And yeah, through understanding that, I think you can move forward, especially in settings where you're seeing a lot of death, especially in COVID. So I said that was definitely one of the strategies that I used to cope with treating patients and eventually seeing them die.
Before you leave, Dr. Calvert, what message do you have to leave for young people?
Okay, so all the young viewers out there that are listening today, I would say continue pursuing your dreams. It's hard. You may sometimes feel like you're not smart enough, you're not gifted, and that probably settings that you're currently in are not the best, or you probably don't have the best resources, but just not allow to deter you from your path. Rome was a bit in a day, and just keep on improving yourself each day, working on your goal each day, and it will eventually happen. Just try your best and keep positive, no matter the circumstance.
Good words. It was great talking to you, Dr. Calvert, and
thank you for having me.
I'm looking forward to the reformation of our healthcare system.
No problem. We'll definitely do.
And everything.
No problem. And I hope this interview inspires somebody to, as I said before, become one of the persons that are at the intersection that can actually, lead the country forward, especially in the domain of health.
Thanks again.
Thank you so much for having me. It was a pleasure.